You and I started musing about healthcare, and we started talking about interactions that our family and our friends and our loved ones and real talkers who've emailed into the show have had with the Canadian healthcare system. We started musing about health tourism, about people that have done what they need to do to travel internationally to get the health services that they've been waitlisted for here at home. And the conversation, candid and unscripted, didn't land wonderfully with everybody. Now, I could have sat and responded to everything that we saw on social media, but I did see an opportunity to maybe present a special edition of our Friday tradition that every week is presented by our friends at the Dairy Queens of Northwest Edmonton and Sherwood Park. This is your chance to bring the heat. We're looking for your hot takes. It's a tradition that we call the Flamethrower, presented by the DQs of Northwest Edmonton and Sherwood Park. So this is a Mean Tweets Jespo edition of the Flamethrower. These are some of the responses we received to my comments about healthcare in Canada. How about this one from Bianca, who says about Jespersen, he's always been an asshole and he'll blow wind with whomever is paying his paycheck. You can't get someone more on the fence than Jespersen. There was this one from KingRobin, who says Jespersen is rebel news now and is carrying water for the Wild Rose and the UCP. He appears now to be a khaki-wearing, tiki torch-carrying member. There was this one from Christa, who wonders, is there anything more confident than a mediocre white man firing out a shit take for engagement? This guy is about as relevant as an 8-track player. Please, God, let him go away. Pepper sent us a tweet. He's just another puke looking for attention. Wasn't it the United Conservative Party that got Jespersen fired in the first place? Now he's trying to attach himself to their bandwagon by sticking his nose right up their ass. I hope he crashes and burns because, you know, life's not fair. This one from Steven, who says famous guy fundraises for private healthcare, thinks everyone else can do it with the same success. It sucks so hard that this loser is the guy too many Albertans look to for a progressive take on politics. We got this one from Larry, who says, Jespersen's a fucking idiot. Told ya, useless windbag with no future. A dinosaur from the days of a thing called radio. Fuck this right-wing nut job fake. We heard from The Pulse down in Calgary, who says Ryan Jespersen is a shitty person with shitty friends and has been from the start.
I resent that.
And what about this one from Andy, who says, after I talked about my friend who just passed away, funny how you whine about your friend having to pony up, all while advocating for a system that will do that to everyone. You don't care about your friend, you spineless piece of garbage. That from Andy. All right, listen. Healthcare is vitally important to all of us. For many people, it is the most important social safety net that's out there. And for that reason, talking about healthcare can become very emotional and very polarizing, especially when we're talking about access to care, especially when we're speaking candidly about access to resources. But since this show's inception, mid-pandemic, we have celebrated and fought for healthcare professionals. Like many of you, we're watching our family, friends, neighbors cash in their RSPs, double mortgage their homes, do everything that they possibly can to secure the treatments that they need. They're stuck on wait lists, some of them for more than a year, and they cannot afford to wait. And that's why they're trying to crowdfund their way out of trouble. This is not a good thing. This is not always the wealthiest people among us. These are our fellow Canadians that are acting out of desperation to hit their ailments head on because they can't afford not to. Now, one thing I guarantee that we can all agree on is that our system is not working. And in many cases, patients are not getting the expedited treatment that they need. Our valued healthcare workers are burned out and demoralized, and too many communities are either waiting for hospitals or holding together their hospitals with duct tape. We promise that we will continue to ask the questions that may rub some people the wrong way. Let's do our best to keep it civil. Let's do our best to keep it real. And let's never forget, we are all in this together. One love, everybody. Have a safe weekend. We'll see you again live right here on Monday morning.